Next up, I'd like to welcome Dr. Juan Espinoza. Juan is a pediatrician, clinical researcher, and a champion for technology and innovation in healthcare. He currently serves as the medical director of the Innovation Studio at Children's Hospital Los Angeles. Aside from that, he's involved with a variety of organizations working to improve health outcomes and reduce health inequities in pediatrics. Let's chat with him. Hey there, Juan. Thanks so much for joining us. For our viewers tuning in, could you tell us a little about yourself and your background?
Yeah, hey Zach, thanks for having me. It's good to be here. Yeah, I'd love to tell you. So I'm originally from Venezuela. I was born there, grew up there, moved to the U.S. To go to high school here. Lived in New Orleans. Then I went to college in St. Louis. Went to the East Coast to do research at the National Institutes of Health, and then eventually came out to California, where I went to medical school at USC. And then have been here in LA ever since. I did my pediatric training at Children's Hospital Los Angeles. And after I finished my residency, I decided to stay on as faculty, and I've been really working on thinking about ways that we can use data and technology to help close the health gaps that underserved communities face, both here in the U.S. and abroad. So my research portfolio is global. I do work in the U.S., in Haiti, in Armenia, but everywhere the thread is how can technology and data help us achieve better health outcomes for populations. That's who I am at work. I'm also a gamer. RPGs are my genre. I've been playing Final Fantasy since the first one, and it's probably my favorite game series. And so having the opportunity to work with an organization that taps into that gaming community has been really wonderful for me.
You and I first met a few years ago, and I remember being excited hearing your thoughts on the impact games and play have in hospitals. Can you share a bit of your perspective on that topic with our audience?
Yeah, absolutely. We met within the context of talking about child life specialists, right? So these are healthcare professionals, people that work in the hospital whose entire role is to make sure that patients, pediatric patients, that their experience while they're in the hospital is as comfortable as possible, that it feels like something that they're familiar with. Being in the hospital can be really scary, very alienating time. And so our child life specialists work with kids of all ages, from babies to adolescents, to make sure that time they're with us is in fact a time of healing in collaboration with the healthcare team, but also that they're enjoying that time as much as possible, that they feel comfortable and feel at home. And a big part of how we do that at hospitals is through games and through play. And video games are a great tool to help out our patients. They can help with distraction. They can help with entertainment, and those are things that are really meaningful to their experience while they're hospitalized with us. But I think that's something that we see every single day in the hospital. The opportunity to have access to games helps bring some normalcy, and almost, not almost, and some fun to that experience that can otherwise be really, really stressful and really, really difficult.
What are some ways hospitals can be more active in adopting games like technology? And are there ways the public can help?
Yeah, that's a really great question, because it talks about two different pieces. Is what can we do as a place to deliver technology to the patients, and then what can people do to help us in that mission. So in terms of what we can do, for example, in our institution, we have over 300 beds in our hospital. And if we wanted to make sure that every single patient had access to games, for example, that is an entire operation. That's a team of people. There's technology. There's the maintenance component, making sure that things are being updated, that they're being cleaned, they're being cared for. There's really big logistics component of actually helping to make sure that patients have access to games that are appropriate for them, but that are meaningful to them, and that they have access to it for an amount of time that's relevant, right? You could have a few carts and then try to just run them around the hospital, or but that doesn't really, that makes a difficult experience for some kids, or some kids might end up waiting a long time to engage with a game. And so certainly being able to have the right supply or stock of hardware and games to entertain patients is a logistical question. In terms of what other people can do, I mean, certainly the first is the most obvious is that it's an expensive proposition to actually make sure that every patient in the hospital has access to games. And so by contributing to organizations like Gamers Outreach, they can really make a difference in the experience that patients have in the hospital.
Juan, now that you're part of the team, what sort of impact do you see yourself making as a board member?
Yeah, it's a good question. What I'm hoping to be able to contribute is my perspective as a physician and somebody who provides care to who benefit from the activities of this organization. The other thing that's something that's really important to me and is part of both my research and my clinical work is thinking about health equity and thinking about access, and how do we make sure that we're reaching otherwise underserved communities. And so I'd love to work with the rest of the Gamers Outreach, the leadership and the board, to think about ways that we can target our support to ensure that we are providing through our relationships and through our giving, that we're doing that with an equitable lens to those activities.
Is there anything you'd like to say to our audience before signing off?
Yeah, the most important thing I want to say is thank you. If you've never either been hospitalized yourself or been with a child who was in the hospital, it never hits you quite as hard until you've seen that. But so I want to tell you, from somebody whose job it is to see those patients every single day, that the work that Gamers Outreach does, that video games in the hospital makes a real difference for patients in what is sometimes the single hardest time of their life, or one of the hardest times of their life. And it's really, really meaningful. So supporting this organization and supporting this work goes a long way to bringing smiles to kids in hospitals all over the country. So thank you. Thank you for all you do, and thank you for your giving.
Awesome. Well, thanks a ton for joining the team, Juan. We're super glad to have you aboard.
Yeah, thanks for having me. I'm really excited to be a part and to hopefully contribute. And I hope everybody has a great time.
That does it for introductions. Our leadership team helps ensure Gamers Outreach is fulfilling its potential. We're on a quest to make play readily available in hospitals, and our board are active participants in guiding our efforts. We're so excited to welcome Heather and Juan to the crew and look forward to the impact we'll make together. If you're curious to learn more, you can check both of them out at gamersoutreach.org.